I'm Agnese Suppiej. I'm Professor of Pediatrics, Child Neurology and Neuro-Ophthalmology at the University of Ferrara, and I'm caring for children with low vision since 20 years, and I'm expert on electrophysiology, especially in very young children.
I'm David Keegan. I am a medical and surgical retina specialist based in Dublin at the Veneto University Hospital. I am the clinical lead for the ERN-EYE Irish Consortium, or EEIC. I co-chair the Transverse Working Group 5 on low vision with Agnese, and our goal is to improve access to low vision therapies for those suffering with vision impairment and blindness.
What are the points of your roadmap within your working group that are completed?
So our roadmap was very ambitious, but what we completed to date via the meeting at O'Deal was the definitions of low vision and blindness for acuity and visual field. And in addition, we've completed a multidisciplinary team approach presented by Agnese and her group on how to manage a child with low vision needs through a life cycle approach. We've also completed some patient care plans and an overview of those care plans. And we've completed a survey which is due to go out as an audit of low vision services across Europe throughout all the HCPs involved in the ERN.
What are the points of your roadmap that are in progress?
The main project we have in progress at the moment is the development of the clinical consensus statements. This is an ambitious program from the group where we are looking to provide clarity about the best vision testing and methodologies used for children and adults. This will be followed then by clinical consensus statements on functional vision and patient-reported outcome measures. In addition, we are developing more webinars and instructional videos on the best ways to deploy these vision tests that will bring through the clinical consensus statements, and there'll be instructional videos on these. In addition, we are proud to partner with the EPAG members in our work group, and they're going to develop and run a webinar series on the lived experience with vision impairment and blindness. What really is planned is building on the work that we have done through development of those clinical consensus statements around functional vision and patient-reported outcome measures. But there's a real need in our field to develop outcome measures for clinical trials, and we'll shift the focus of our group with our new collaboration with the International Society for Low Vision Research, or ISLR, and we will develop those clinical outcome measures for clinical trials and disseminate those to the other work groups in the ERN.
What does this exchange bring to patients?
Yes, benefit for patient is to produce pathways, and these pathways will allow patient to have the same level of care all over Europe. And this will be important. The important part in our group is that we foster multidisciplinary approach. So this will bring ophthalmology within a core group that will be helpful for patients, because we also will foster the possibility of habilitation based on a good diagnosis of low vision, and we will also spread this knowledge through guidelines and also to webinars. So to produce this will spread the knowledge of all over Europe.
What does this exchange bring to healthcare professionals?
For healthcare professionals, they will benefit as patients of spreading of this knowledge, but also we provide outcome measures for clinical trials, and this is also very important for professionals looking for new therapies for patients.